Breast cancer is the most common cancer amongst Canadian women. In fact, 1 in 9 will develop it within her lifetime. Today we're going to look at a different screening method conveniently located right at Yonge and Sheppard.
Thermography as technology is really predictive. So whether we're looking at breast screening or risk assessment or let's say pre-stroke conditions or inflammation or things like soft tissue damage or inflammation, thermography is able to show us things that are really not visible or detectable by other technologies. Infrared is a spectrum of light that measures heat. A lot of women will come in and say, okay, you're telling me I'm high risk, now what do I do? Well, let's check your hormones first. Let's check your diet. Let's check your lifestyle. So this is a good impetus for change to start on that positive change and be responsible for your health. Instead of waiting for the guillotine to drop and say, okay, now we have breast cancer. We basically work with a TH rating, thermography rating, starting from TH1, which is low risk, going all the way to TH5, which is high risk.
So why don't we do a quick screening on myself, and then we'll see what we get. So tell me, we're looking at my image you just took. Can you explain a little bit what you see here?
Well, when we're looking at this particular image, again, what you're looking on the side here is a color scale. So darker colors are cooler, lighter colors are warmer. The span, in this case, is between 32 and 35 degrees Celsius. So there's just 3 degrees Celsius. Colors like red or white are going to be over 35 degrees, right? Anything under 32 is just going to wash out to black. You see you have a cold spot on the left side of your nose here, whereas the other side is a little warmer right there. You also have a little bit left over probably from your cold that you had a while back, which is the frontal sinus, still inflamed here.
So while you're saying this and I palpate the area, it's a little tender.
It's tender.
It's tender over that area versus the other side, it's not tender at all.
Sometimes we can also look at the area of the thyroid. In your case, it appears to be normal, but in some cases we can look at hot nodules. Sometimes we see cold nodules. Usually we see hot nodules, right? So we can differentiate between nodules on the thyroid because they will produce different heat. And again, it's a non-invasive way of looking at things. But certainly in your case, I would look into or possibly kind of keep an eye on dental issues on this side, maybe TMJ on this side.
So if you were recommending then when I would do a follow-up, what would it be around?
I'd ask you maybe to come back in a couple of months and see, are you changing, are you staying the same? Is this your thermal signature in a sense?
Early detection is the best prevention for breast cancer. For more information about this non-invasive screening, go to thermographyclinic.com. I'm Dr. Scott Levine, and that's Toronto Living.